Hi, I am Nikki Soda, the Membership Development Officer for NAATP. And in continuation of Membership Month, we have with us Dr. Tom Britton, who is the President and the Chief Executive Officer at Gateway Foundation. Hi, Tom.
Hey, Nikki, it's great to see you.
Thank you so much for taking some time out to visit with us. On top of running an organization, Tom is also on the NAATP board, and we are very fortunate to have him as the membership committee chair. One of the things I wanted to start out with is, could you tell us a little bit about Gateway Foundation and what you guys have been doing in regards to pivoting in response to COVID-19?
Sure, of course. So Gateway Foundation, 52-year-old not-for-profit substance use provider. We have 100 sites nationally. We treat almost 10,000 people a day. So some of the services we do are in correctional environments where we have what look like treatment campuses, but they're people under judicial control of some kind. And then we have an additional 800 treatment beds in normal community settings and, what looks like residential drug treatment. And then we have outpatient treatment as well.
You're helping a lot of people, which is phenomenal.
It's exciting.
In regards to COVID-19, could you tell us a couple of things that you guys have done in response to?
Sure. I'm a public health doctor by background, and as I was looking at it coming into the United States in the beginning of March, it was really clear that this was going to grow a lot more than anybody was even talking about at that time. So we were early adopters about virtualizing all of our outpatient services by the second week of March, and we implemented in all of our residential environments pretty tight screening and quarantining measures for any client or staff that was presumed positive. And so for all of March, anyone who had direct exposure to a client or anyone with COVID or anyone who presented with any symptoms of COVID, we isolated for 14 days outside of the organization and provided full pay and benefits and everything like that to make sure we didn't bring it into the unit. In April, the federal government brought the unemployment support online, and so we shifted a little bit in the way we were supporting and leveraged some of the federal benefits. But we've really kind of increased the amount of controls we had, and we've been very, very fortunate in the level of exposure. Tracing technology is really, if you have a positive case, you test a certain group of people. And so far we've had 28 presumed positive staff throughout 1,500 staff in the last 2 months. Anytime we have found out that either a staff or a client was a confirmed positive for COVID, we tested everyone, client or staff who came into contact with them. And in all of that, we've only found 12 people that were positive, all of whom were asymptomatic.
That's interesting. Well, it's great that that's your background. And so who better to be making those decisions than to start implementing those practices? Tom, what was your first exposure to NAATP?
So I think, I'd heard about them for a long time, but I went to my first conference 5 or 6 years ago, and I really liked the conference. I worked at a job at that time where I traveled nationally, but it was all for profit. And I think it was a year or two before I came back. But when I came back, I really engaged more with the people that were coming to the conference. I met a lot more of the leaders that were going to the meetings. And I think I saw the potential really to build a different network with leaders from around the country rather than my immediate surroundings. And it's been really great.
What led you to want to be on the board?
So I think for me, Gateway is the biggest not-for-profit in the country that does what we do. NAATP has really been advancing quality of care as a foundation, and they've been advancing policy, nationally. And I felt like part of my personal mission is to provide better care to those that we treat. I'm a person in long-term recovery, and I don't really think it is fair to not provide scientific-informed addiction medicine to everybody we treat. So it was kind of a win-win for me because I was able to join the board and really help advance the quality of care, but also build relationships with other executive directors and CEOs to kind of advance my own personal understanding of what best practices were.
Connection is a huge part of what the association does, and it's in our mission statement. What is something that you would encourage NAATP members to do in regards to connecting with each other?
Conference participation is a really big deal. They talk about in 12-step meetings that the most important meeting is the one before the meeting and after the meeting. And I think the same thing is true for NAATP, is going and fully participating in the social activities and introducing yourself and engaging yourself. You're going to get key updates there that nobody else is getting. Some of that we had like a couple of years ago, for example, folks from Google who talked about why they did the change in advertising, and it gave a kind of interactive environment. It was just really, really special.
Would you be willing, and I'm putting you on the spot, if there's a member listening that has a specific question for you, to be willing to take the time or to have someone on your team to visit with that member?
Absolutely. I think that's how we get stronger as a connection. And one of the things we've done at Gateway to figure out how do we really kind of continue running our residential programs, for example, is when I found out that we had positive staff, I paused admissions for 10 days because I didn't feel like I could safely manage the environment. And my responsibility at the end of the day is keeping people safe. And we were able to put in place testing of all admissions where we got the test back in 48 hours, for example, so that I could bring somebody in, keep them in an admission unit. Once they're positive or negative, decide where to send them with. And without those conversations, we're all trying to figure it out on our own.
Thank you very much for that, Tom. My last question is, what would you say to a facility that is interested in becoming a member and they ask what the value or why should they become an NAATP member?
I think that part of it, and this may seem, I don't know, overly altruistic, but I think part of it is an obligation to support an organization like NAATP to do the work it's doing. I think literally it is good for the field and the people that we treat. And I think whether you're for-profit or not for-profit, we're in it to save lives, and NAATP helps that. From a more selfish standpoint, you're going to get access to the research and the process that NAATP is coming up with. And the most recent initiative is a really exciting thing led by Dr. Annie Peters. She was hired, and this is a new project with NAATP that's really saying we want to set the standard of care for what is quality intervention within the field. And there's a lot of other agencies trying to do that, SAMHSA and Shatterproof and all these. But I don't think there's anybody as qualified as we are. And if we don't set the standard, then the standard is going to be set for us.
Well, I can say that NAATP is extremely fortunate to have you not only on the board, but as an ambassador, and I know for myself as the membership committee chair. So thank you for all that you do, Tom, and greatly appreciate your time today.
Thanks so much. Appreciate it. Take care. Be safe, everybody.